internal medicine residency at Michael Reese Hospital from Chicago, and he's had a lot of experience from Christian Medical College, Vellore. Currently, he is a president of Indian Heart Rhythm Society, and he has held very distinguished positions in the past. President of Indian Society of Electrocardiology and editor-in-chief of many PubMed Index journals related to cardiology. He is also the governing body member of the Indian Heart Rhythm Society, and he's received several awards, the most distinguished of which are the Goldsmith Award for Professional Competence from Chicago, Best Teacher Award from Chicago, Goldsmith Award for Teaching and Professional Competence from Chicago, and the Gold Medal for Final Year MBBS from University of Madras, Tamil Nadu, as well as a Gold Medal for DM Cardiology from Dr. MGR University, Tamil Nadu. He's done a lot of research in this specific field, and also published many books, including a book on Introduction to Electrocardiology, which is published by Lippincott in 2013. So with this brief introduction, I now request Dr. Millen to put on his lecture for today.
Good afternoon, friends, ladies and gentlemen. At the outset, I would like to thank all of you, the organizers, for this kind invitation. I was tasked to speak about preventive aspects of cardiovascular disease. I titled it as a key to good life because several of these practices, whether it's diet, exercise, or outlook towards life, when they are better, they have better cardiovascular outcomes. Now, why are we talking about this condition, cardiovascular disease or heart disease? It's because that is the major cause of death worldwide. 1 in 4 deaths are heart-related. And the good news is several of them are preventable, either with lifestyle changes or with medications, and rarely with some interventions. And I would like to assure you that several of these things are in your hands, and there is a significant reduction in risk of cardiovascular disease that can be achieved by changes in lifestyle. Now, there are a couple of things that you may hear in daily press. Coronary artery disease or ischemic heart disease refers to blocked blood vessels of the heart. Heart itself needs a lot of blood flow, and when they get blocked, it's called coronary artery disease or ischemic heart disease. Heart attack is when the blood flow completely stops to the heart and that area becomes a infarct, the tissue becomes dead. Heart failure is a condition where the muscle is not able to pump effectively. Therefore, there is a back pressure change in the lungs. The patients become breathless. They develop leg swelling, so on and so forth. Stroke refers generally to reduction of blood flow, or where a particular portion of the brain loses its blood flow, and patients either lose speech or power to move the opposite side of the body. Arrhythmias refers to irregularities in heartbeat, either slow beats, rapid beats, missed beats are all called arrhythmias. Now, this is a real life patient where morning after early morning, he goes to the office, starts running up the stairs, has some chest discomfort, has profuse sweating, collapses, and then he's immediately picked up by his colleagues and brought to a hospital within a couple of hours. You see, this is a blood vessel. Suddenly, there is a cutoff. The blood flow is marked by the contrast. The iodine dye is black in color. There is an abrupt cutoff. And when this area was aspirated, you found a lot of clots like this. Once the clots were removed, you find the blood flow has been re-established to the vessel, all is well. But it's not always that rosy. Let's just go back and see what happens in this process of heart disease. Normally, the blood vessels that we have are circular structures. For just explanation, it has been dissected and you're seeing one half of the vessel. This is the internal layer, internal-most layer called endothelium. And then there's a muscular layer, and then there's 3 layers. Now, what I would like to impress upon you is this innermost layer is very smooth and it doesn't allow any of the blood cells to stick around. So the blood has to slide forward. And it doesn't allow any of the material within the blood to percolate into the deeper areas of this blood vessel wall. However, with aging or diabetes, high blood pressure, or smoking, all these risk factors cause dysfunction of this inner layer, where the endothelial layer becomes a little more sticky and it allows the blood cells to clump around the surface of its inner surface. It also allows, it becomes more permeable and allows the cholesterol to seep into the deeper layers of the vessel. Over year on year, layer by layer, it gets built up. And because cholesterol is a foreign body in this area, it attracts a reaction. The immune cells come and reactivate and cause a certain degree of inflammatory response. And by chance, this inflammation either worsens or suddenly there is a burst of physical activity and burst of emotional outburst. There can be a rupture of this plaque. Once the plaque ruptures, it's a bare area. There's no endothelium there. So all the cells will clump together. Within 20 minutes, the vessels will become completely blocked. So this is what happens. There is a substrate for several years that is going on layer by layer. One fine day, it's an extreme degree of either an emotional activity, physical exercise, or something that is unusual that causes a plaque rupture. Now, this is also the reason why COVID, for example, following a viral infection, these cells that accumulate, they are called macrophages. They become more active during COVID and they tend to break this barrier and suddenly the place becomes sticky and clots form. This is the reason why we saw a lot of heart attacks during COVID, both heart attacks and strokes. Now, patients have different presentations. Now, the same cartoon to explain, this is the inner surface, which is smooth. Over a period of time, layer by layer, it starts depositing. That's called as a lipid block. Lipid is fat. It gets accumulated. And suddenly, for some reason, a viral infection or any of the trigger, the plaque ruptures. And within minutes, the blood starts coagulating there, forms a clot and occludes the vessel. And that is what results sometimes in sudden cardiac death. If it happens in sleep, the patient is not even aware, and next morning the relatives find that he is no more. Now, there is a lot of literature that is confusing. If you in social media, especially, do this, do that, don't do this. Lipids are good, lipids are bad, so on and so forth. This is a very elegant study which was done in 1970. It was published in one of the premier research journals, where they took monkeys and they fed them with high-fat diet. And over a period of time, this cholesterol buildup almost occluded the vessel. It becomes very, very narrow. After 6 weeks, they sacrificed the animals and then looked at this. The control group, after about 6 to 8 weeks, they reversed the diet and started putting them on a healthy diet. And after a couple of months, they sacrificed and they showed that this block, which was in the other group, had cleared. early on, there is evidence that you can regress this atherosclerosis by changing the diet. So high saturated fat can be harmful in some group of patients, especially when they have a risk of coronary disease or family history of high cholesterol being there. Now, this is again a very nice study which was published in American Heart Journal, Journal of AHA, where you look at on this side very less amount of plant-based diet, moderate amount of plant-based diet, very high percentage of plant. Suppose your plate is there, less than 10% of plant-based diet and a predominant plant-based diet. Now, this is the ratio of heart disease and death. So as you start increasing the plants, the risk of sudden death, heart attack, everything over a period of time comes down. So there is a very almost a curvilinear relationship between consumption of plants, plant-based diet, and improved survival. Now, all plant-based diets are not the same. There is something called as an unhealthy, that is less healthy plant foods. Now, this is what most of us consume. Fried potato, fried brinjal, fried vegetable samosas packed. We think we are eating vegetables, but actually look at the mortality. That is worse than animal food. So this mistaken notion that a vegetarian diet is superior is true only when you have healthy plant-based diet, not the kind of saturated fats like fried bhajis, samosas packed with vegetables doesn't mean it's healthy. So there is, again, to show that the greater the amount of fruits and vegetables one consumes, you find that the mortality comes down. So what do? We tell our patients to increase the amount of fruits and vegetables. Fruits, for example, should not be overripe. If it's overripe and very sweet, it's more or less sugar. So fruits, vegetables predominantly as salads or steamed vegetables rather than frying the vegetable. Have whole grains. This is especially important because the whole country as India, we started moving towards unpolished rice somewhere in the early 1900s. That is when the polishing of the rice started, and we lost the benefit of an unpolished rice, which has got a high fiber content. So if you're having oats, for example, don't take refined oats. And similarly, people who consume fish, chicken, or lean meat is good, but don't fry this too much. There is, increasing evidence that olive oil, nuts, the Mediterranean diet provide a significant benefit in terms of reduction of cardiovascular disease. Avoid processed food. The commonest misconception is fruit juices. Fruit juices are sugary drinks. It's better you avoid and take the whole fruit instead. When you're thirsty, have water, or you have buttermilk rather than any kind of sugary drink, Coke, Pepsi. All these things are not considered to be healthy substitutes. Similarly, trans fats, when you fry the food, that's what happens. Most of the mixture, samosa, bhajis, burgers, pizzas, most of them contain this kind of food. So this is again a very nice study. This is on over a period of 5 years. This is a control group where they were allowed to eat whatever they wanted, but the other group were provided a significant amount of nuts and olive oil. When they consume this over a period of time, there is a very significant reduction in acute myocardial infarction, that is heart attacks, stroke, or death from cardiovascular disease. All the important endpoints are improved when you consume more nuts in your diet. Now, what about exercise? The greater the amount of activity that the person has, for example, step count of 1,000, 6,000, 10,000, as the step count increases, the risk of death comes down significantly. Say after 10 or 12,000, it's more or less flat, but at least move to get at least 6,000 to 10,000 steps per day. Any incremental benefit is useful for you. Now, I would like to pause and say there's a word of caution. Vigorous physical activity is not advisable for elderly people or people with suspected cardiovascular disease. You need to be very gradual, adequate warm up, and consistency is the key. Do it every single day, 30 to 40 minutes morning and 20 minutes in the evening. That has a significant impact in terms of reducing cardiovascular events. What about environment? If you have an environment which is very noisy, background noise is there, loudspeakers blazing, and there are buses honking, you find that has a significant impact of worsening cardiovascular death over a period of time when the noise levels are high. So if a person has a heart attack and following heart attack, if a person has standard medical therapy, over a period of time, say about 5 years, 10 to 20% of them will have another event. Whereas if these patients undergo significant psychosocial counseling, as well as rehabilitation in terms of physical as well as mental rehabilitation, their mortality significantly comes down over a period of time. It's important to keep the stress levels low, and there are several breathing exercises which I'm sure they're going to discuss. Regular physical activity, adequate sleep, be in the present, socially well connected, and try to pursue the activities that we enjoy. And there's increasing evidence that meditation and mindfulness helps to be calm and reduce the level of stress in a given individual. And whatever you are doing, be conscious. Try to, instead of ordering food, go walk up and get it before every meal. If you even walk for 15 to 20 minutes before a breakfast, lunch, and dinner, that is a good start. Gradually, you can start increasing. Aerobic exercises are like walking, swimming, dancing, cycling. Strength training, if you're a young person who is otherwise fit, then it's important to increase resistance training and weight training, use the resistance bands. And it's very important, as you all become old, the joints become stiff, the collagen becomes stiff, you cannot get up from the chair, not bend. Yoga is an excellent exercise that way because it stretches your muscles, the joint becomes more flexible. And if you're elderly, I would strongly recommend you, because, and secondly, the risk of injury is very low with this compared to any other exercise. And I cannot overemphasize the importance of good sleep hygiene. You get adequate about 6 to 8 hours of sleep. If you have sleep difficulty, consult a physician who's, or as a person, a psychologist. If you think you are stressed out, they can help you out with some of these interventions. If you have never checked, at least at the age of, say, after 40, it's important to check your blood pressure periodically. Once a year, at least get your cholesterol checked, blood sugars checked. These are the numbers. Keep the blood sugar below 120 by 80, especially if you have a family history of stroke or prior history of brain hemorrhage in father or mother. Usually BP makes its appearance after about 30 years of age, between 30 to 50 years of age. And if there's a family history, measure your cholesterol and keep this is LDL is the bad cholesterol, keep it below 100, and the good cholesterol is preferably above 40. There are no medications to improve the good cholesterol except exercise. So if your good cholesterol is low, you should consciously start exercising a little more than the others. Maintain the blood sugars always in the normal range. So if you are addicted to smoking, this is one thing I would like to emphasize. This is a very strong risk factor for heart disease and sudden cardiac death. We strongly suggest, if you are unable to stop, take the help from one of the smoking cessation clinics, one of the healthcare providers. They'll be able to help you get out from this habit. Excessive alcohol, again, increases the risk of arrhythmias, increases the risk of certain cardiac diseases. And in moderation, occasionally as a social drink is okay, but regularly we suggest avoid for several reasons. And there are other risk factors which are coming up, like lipoprotein little a. I'm not going to talk about that, but it's important to recognize the symptoms of a heart attack. It need not be a chest pain all the time. It may be shortness of breath. Sometimes it may be pain in the shoulder, arms, or elbow, neck and jaw pain, unexplained back pain, and associated with nausea, vomiting, and giddiness is often a sign of heart attack. It's important to recognize if one of your relatives is suffering from a stroke, because nowadays, if you take these patients within the first 2 to 3 hours to the hospital, they can recanalize the vessel and you can prevent the stroke from worsening. So, sudden drooping of the face, sudden unexplained arm weakness, speech difficulty, loss of speech, you should take them to a center where they can receive immediate care. So, most important, again, to summarize, take small, consistent, incremental steps to increase the level of physical exercise 3 times a day. It need not be a vigorous, fancy exercise, going to a gym, all those things. Just walking, swimming, cycling, going in a park. These are simple things. And if you cannot walk out, the surroundings are not very, your payments are a problem. All these problems do exist. Yoga is an excellent, all that you need is a yoga mat at home. Start doing that regularly, preferably to start with, get a proper instructor. So every month, even if you increase it by 5 minutes, that is better. And this has been shown to improve several of the cardiovascular outcomes. And it's important, if you take the steps right, changing your diet, exercise, controlling the risk factors like diabetes, hypertension, you can prevent the disease from worsening at this stage. And it may remain as a small plaque for several years together. You may find a little calcification in the vessel here and there, but you will never have an occlusion of the vessel if all these steps are taken. It works very well in a vast majority of the patients. Occasionally, there are some patients, despite doing all these things, they succumb for some unexplained reasons. It could be an occult viral infection. It could be some novel risk factors, but that needs to be explored by a specialist. I think I'll end here, and thank you all for the patient listening. If there are any questions, we'll be happy to take. Thank you.
I would like to take a moment to thank Dr. Narsimhan for preparing the topic on how the general perspective about cardiac well-being and how lifestyle modifications and diet modifications can help reversing and pausing the progression to a major cardiac disease. Sir couldn't be here with us due to some unexpected family medical emergency. We will move to, if any of the participants have any questions, we'll be taking the questions towards the end. Now we will be moving to our second speaker. I invite Dr. Sailaxmi Gandhi to introduce our second speaker.
Thank you, Dr. Midan. So the second speaker for today is Dr. Sundarnag Ganjekar. So till now, we heard about cardiac health, and now Dr. Sundarnag will be talking about the cardiac risk factors in people who have mental illness. So he is additional professor in the Department of Psychiatry at Nimhans. He's also the head of licensed psychiatry at Nimhans. He's done his MBBS in Mysore Medical College, Karnataka, and his MD psychiatry at Nimhans. He has his area of interest is predominantly women's mental health during pregnancy and postpartum, nutrition during pregnancy, consultation-liaison psychiatry, and adult psychiatry. He's also done a lot of research projects and publications, some of which are related to exactly this topic. And I think he's the most appropriate person from the Department of Psychiatry to handle this topic. I now request Dr. Sundarnag to start his session.
Thank you, ma'am. Thank you for being a part of Road to Recovery program. Okay. So, Milan, yeah. Actually, Narsimha sir has actually made my job easy, to be honest. He has told no more the preventive aspect, which I think most of us needs to do, including persons with mental illness. So what I'm trying to focus today is on what kind of evidences, like say for example what sir was mentioning about the evidences, what happens if you change the diet, you will be able to reverse that. So that kind of data may not be available, but what kind of data is available in the literature regarding what happens to a cardiac health of a person with mental illness. Can you change the slide? Yeah. So let us see, from the global perspective, as sir was mentioning in his presentation, the cardiovascular diseases are the #1 around worldwide for the cause of death. So, if we look at the recent data, say, 19.8 million deaths have happened due to cardiovascular diseases, which includes, as sir told, ischemic heart diseases, cerebrovascular diseases, all those are included in that one. So if we try to look at, though, say if what happens in persons with say severe mental illness or common mental disorders, say depression, anxiety, this Correll has done a kind of an extensive review, which was published in World Psychiatry Journal in 2017. So the number of patients which he has it's a meta-analysis where it's a pooled sample of persons with mental illness, especially severe mental illness like schizophrenia, bipolar disorder. He has taken in that meta-analysis around 32 lakhs 11,000 patients of with severe mental illness, and it was compared to a control group which has included almost like 11 crore people, 11 crore 33 lakhs people. So when they did a meta-analysis controlling for many of the confounding factors, what majorly what he's found was there is a higher incidence of cardiovascular diseases among patients with severe mental illness. So there is higher incidence of coronary vascular disease, there is higher incidence of congestive heart failure, as well as cardiovascular related deaths in persons with severe mental illness, which also included bipolar, schizophrenia. And they found certain factors which can influence, say for example, cardiovascular diseases incidence increases if there are antipsychotic use, there is a higher basal metabolic index, BMI, and higher incidence of cardiovascular disease if they had a past history and now they developed a kind of mental illness, then there is an increased chances of that. So what also they found that overall, there is an increased prevalence of cardiovascular disease, but the incidence has not really kind of changed. Now, if we try to talk about depression and cardiovascular diseases, they say that there is a kind of a bidirectional relationship between the depression and heart diseases. So the presence of in a person with depression, it increases the risk for cardiovascular disease by 20 to 50%, means it's almost double in the pooled study, as well as the presence of cardiovascular disease itself can increase the chances of cardiovascular depression. And the presence of depression in individual with cardiovascular disease is a kind of a poor prognostic indicator. Okay. Next slide, please. Yeah. Now, if we try to look at in India, so the cardiovascular disease burden is, because we are the the nation with highest population, we have the highest burden of cardiovascular diseases as well as deaths annually, which not only the Indian data but also the WHO data shows that. Okay, and the prevalence of cardiovascular disease is is nearly 11%. If we try to look at persons with mental illness, there have been a lot of reviews which has been done. So one of the recent review was done by the SCARF team, Dr. Padmavati. She has done what is the cardiovascular risk among patients with schizophrenia. So then she has reviewed a lot of studies, which some of those are hospital-based studies, some of those are community-based studies, some of those are done in southern India, in the rural population, those who are on treatment, not on treatment. So overall, what they found was the high rates of metabolic syndrome, obesity, cardiometabolic risk factors. So there is a which directly indicates that it increases the cardiovascular disease risk. But what clearly the data wise, we don't have very particularly in terms of percentage wise data, but all the persons with mental illness has increased cardiovascular risk factors like metabolic syndrome, obesity, other cardiometabolic risk factors. Next slide, please. Yeah. So then the question is why there is a higher risk among persons with mental illness. So there are no behavioral risk factors. We know that persons with mental illness, there is a loneliness, they have a increased history of smoking, there is a poor diet, there is a physical inactivity, they have increased alcohol use. So these are all the behavioral risk factors. There are biological and treatment factors also. Say, for example, there are medications which can, say, for example, antipsychotics like olanzapine, increases the metabolic risk. It causes dyslipidemia, weight gain, insulin resistance. There are health gaps. Say many of they do not, say the people with chronic mental illness. The medical conditions get underdiagnosed or undertreated, and or when they develop certain event, cardiovascular event, then only the detection happens, and we don't know at what time they develop hypertension or abnormal blood sugar level. Okay, not only that, say in there has been a kind of a bidirectional relationship between depression and the immune factors. That is an inflammation, what sir was talking about, psychological stress and inflammation, that he was also telling that there is an emotional burst when it happens. Okay, or if the person is involved in say climbing or higher physical activity, that is the time when these blocks get bursted. So similar thing happens. Psychological stress also can lead to such an event. So in extension, this is the one which say what sir has mentioned. So how persons with mental illness can minimize cardiac risk. Say, for example, say sir has mentioned that any individual who is more than 40 years of age needs to undergo regular checkup for their blood pressure, fasting blood sugar level, lipid profile. Okay, so a person with mental illness needs to be routinely undergo evaluation for his BP, even though he is young. The evaluation for BP, fasting blood sugar, lipid profile, weight, BMI. Okay, so yeah, for every 6 to 12 months, so that the medications which as a clinician we start on them, whether they have any adverse event on the individual. So if the sir was also mentioning that smoking cessation is one the factors which can drastically reduce the cardiovascular disease risk. Okay, and the physical activity, sir was also mentioning that gradually increase the physical activity, healthy diet. I need not to say anything other than what sir has mentioned. And maybe as a clinician, we also needs to review the medication which we have prescribed, whether it has caused any cardiovascular risk factors, and try to prescribe those medicines. Nowadays, if we look at the literature, there are medications which are, which causes lesser metabolic side effects. Those are like metabolic friendly psychotropics are there. So, and we need to regularly monitor for their side effects also. Okay, sir has also mentioned about mental health care and stress reduction and adequate sleep, which is essential to prevent any cardiovascular diseases. Okay, to summarize, see, the take-home message is that people with mental illness are, they are at higher risk for cardiovascular diseases, and it is a preventable disease which needs a regular monitoring and some amount of lifestyle changes and kind of an integrated care. Means the clinicians as well as the patients should be aware of that increased risk and undergo a regular monitoring in terms of BP, in terms of blood sugar, lipid profile. Start ensuring regular medical checkup, quit smoking, lifestyle changes, and the discussing about the medications risk. So there are a lot of the resources which are available for NCD program in India from Ministry of Health and Welfare, as well as say there are fact sheets on cardiovascular disease from the World Health Organization, which I think needs to be displayed in all the clinics, including the clinics where psychiatric patients they come to visit the psychiatrist or the psychologist for consultation. So I will end my presentation here. I would like to take questions if there are any.
Thank you, Sundarnag sir, for the presentation. Now, open the stage for any questions or comments of the audience. We have one question in the chat box. Dr. Siddhant is asking, sir, in patients with post-myocardial infarction, in post-MI depression, how does depression affect cardiac morbidity and mortality outcomes?
Okay.
Siddhant, got your question, right?
Yes, ma'am.
Okay, in patients with post-MI depression, how does depression affects cardiac morbidity and mortality outcome? Yes, it's a very good question, Siddhant. So, as I told, it's a bidirectional relationship. Okay, so the persons with say those who had a myocardial infarction, there is an increased chances that they may go for depression is much higher. Okay, so they say that there is a say biological underpinning for why persons with post MI has increased chances of going through a depression. One of the robust evidence is from the inflammation pathology. So as sir told that the inflammation is the one major reason for the heart attack. So as the inflammation increases gradually and then there is a sudden burst. So even in depression, there is an inflammation as one of the the etiology for depression has been kind of proposed. So, and if there is a presence, say for example, if there is a presence of depression, it again increases the mortality. Say for example, these are the people who are non-adherent to their treatment, including the diet, physical activity, and in terms of say healthcare utilization are lower in them, which again kind of become a vicious cycle which increases their morbidity and mortality. So, one of the quote they have in one of the textbooks they have given, in a consultation-liaison psychiatry textbook that, the nurse so says to the doctor that, no, this patient, no, who had recent MI, does not willing to take medication. No, he wished to die. So it means to say that the person who has recent MI, there is an increased chances that he goes into a depression is very high. So early identification in them and prevention would be a better. Okay, and otherwise the risk of the further worsening of the depression as well as further worsening of his cardiac morbidity and mortality also increases. Does depot injection like Tolas harmful for persons with mental illness? Okay, Suresh has asked. Tolas is olanzapine injection. Yes. See, overall, if we try to look at the literature, okay, the olanzapine is the one which is known to cause weight gain, which is known to alter the lipid profile. If that individual is a known case of diabetic, it definitely worsens the diabetic or the sugar control. And overall, the metabolic risk is definitely increases. Say, as a clinicians also, when I prescribe or the psychiatrist prescribe, we keep that in mind, whether this individual has increased risk for increased cardiovascular risk. Say, for example, if there is a family history of diabetes or he is overweight, his BMI is on higher side, we usually tend to avoid medications like olanzapine in them. Okay, what are the causes of depression in persons with mental illness and cardiac patients, sir? Okay, Devi has asked. Okay. Causes of depression in persons with, if the individual is depressed, we call them persons with mental illness or persons with depression. They are the people. So, and cardiac patients or the causes of, okay. So as I told that there is a bidirectional relationship between depression in cardiac patients. The inflammation is one proposed theory of why these people are at increased risk for depression. Okay, and the presence of depression also kind of indirectly worsens their cardiac morbidity and mortality by not adhering to the medication, not adhering to the diet plan, not adhering to the physical activity. So there is a bidirectional relationship there. Yeah. Okay, Maha has asked, sometimes symptoms of anxiety or panic attack mimics cardiac symptoms. Please suggest us some of the practical steps to quickly recognize it actually when it is in cardiac emergency. Yeah. Okay, Maha, it's a very good question. Whether is it anxiety or a panic attack? Is it is it a symptom of heart attack? Yeah. See, any individual above the age of 40 years, he first time presents to say a clinic or an emergency room with symptoms of say panic attack. The first thing what we get an ECG done. Okay, ECG gives us an idea whether that individual has any cardiac say morbidity. Okay, ECG is the test which can give us some clue. Okay, as well as when that such patients, panic attack or anxiety attack patient comes, we also take certain history, whether they are non-diabetic, non-hypertensive. So that gives us a clue whether whether there is a underlying risk factors in them. Okay. People can have autonomic symptoms both in true heart attack as well as the panic attack. So it is one of the first differential diagnosis which people keep when persons with mental illness come to say with panic attack to a clinic. So Satya asks, what are the early warning signs of heart disease that mental health professionals should watch for in patients with mental illness, especially when they might not express physical discomfort early? Okay, so say basically we always look for risk factors. Okay, say for example, say if there is a family history of so cardiovascular diseases, whether that individual has any history of hypertension, whether he or she is a known case of diabetes. Even when patients routinely or come to our clinic for the first time, okay, so we tend to investigate them for their metabolic profile. Say they undergo complete hemogram, then LFT, RFT, then fasting blood sugar, PPBS. Sometimes we routinely get glycosylated hemoglobin. So this routine test gives us an idea whether this individual carries any risk factor for cardiovascular diseases. So, and if there are certain risk factors, say for example, the lipid profile is abnormal, then we tend to give them an advice for physical activity or change of the diet plan. So those advices are given. If it is overshooting very high, then that is the time when we get a medical opinion from say cardiologist or the endocrinologist to whether there is a need to start on any medication to them. Okay. So basically, as a clinician, we always look for risk factors. And if there are risk factors, we tend to start those medication which has lesser metabolic side effects. Okay, so that is the kind of strategy which we follow and we teach also. So Sridhar Chandrasekhar has, what is the risk of cardiac problem for caretakers of patients with mental illness? Yeah. See, I kind of, the persons who take care of persons with mental illness, caretakers or primary caregivers, they are always at higher risk for, especially for their stress level. See, if, as Sir was mentioning, in his presentation, so some of the simple, techniques of say yoga, walking, diet changes, and the stress busters. Say for example, yoga activity, or there are many other say techniques of if you adopt to those, then definitely we can reduce the risk of cardiac problem in caregivers of mental illness. Okay, so there is one person. If a person who is working as a medical professional have depression, how to manage? Kindly explain. Okay. So I would like to ask a further question to, his name has come as E00950. So is he not willing for treatment or no? How do you, can he say something? E00950?
Have someone in the chat.
Yeah.
But,
Maybe this person can approach Dr. Sundarnag later also.
Okay. Okay.
Yeah, no, I think he's texted something. I have mild depression. I could make out.
Okay. Okay, I think, then it is a good time to, undergo evaluation by trained professionals. Okay, so you can come to Nimhans, get consultation, or you can visit any of the psychiatrists. If you feel uncomfortable here, you can visit any psychiatrist and convey your difficulties, what you are facing, Whoever sees you will be able to help you out. I can assure you that. Okay. Thank you. Thank you. If persons with mental illness, schizophrenia is 44-year-old, which are the compulsory and routine lab test and screening to do? Okay. So say after the age of 40 years, not just persons with mental illness, even say any individual above the 40 years needs to undergo complete blood count, then fasting blood sugar, postprandial, glycosylated hemoglobin, then lipid profile, LFT, liver function test, renal function test, and serum electrolytes. There are certain advantages to get, say, thyroid function test also. Okay. So there are many, say, for example, no, say vitamin D, then vitamin B12. That also you can get it done, because vitamin B, say B12 deficiencies are much common nowadays. The D, even for say clinicians like us, the vitamin D is deficient. No, even though we have a good sunlight and we take food with fat content. You don't know. A routine test for caregivers had angiograph 15 years back.
I think they meant angiography.
Okay. Angiograph 15 years back. Presently 77 year. Oh, okay. Okay. So does Suresh want to say that they are continue to maintain the healthy? Suresh, are you?
I'm under. See, the stress, the functionality, and taking care of two. One is dementia, my wife, and the son is schizophrenia. Lot of toil, lot of burnout. So many things are happening, but I don't know, because I'm a diehard sportsman. So far, I'm survived. That's what I can say. And my question is, sir, our question is, what after us? For the 44 years, sir, what after us? So we need to be fit and fine.
Yeah.
Any miracle or a mantra? Thank you.
Thank you, sir. The mantra is you maintaining a good physical health. Being a sports person, being very active. Okay, and I don't think you have any other risk factors like smoking.
Yeah, nothing.
So that is the one which is a key.
Yeah.
Right. So you are an example for all of us. That if you leave the risk factors, say for example the smoking, okay, or if you have a good physical activity, you can maintain your good health, without having any cardiovascular diseases.
And one thing I will tell you,
Yes,
that
sir.
only in 2009 declared dead but survived. Only once I had a angiography. I was declared dead and then survived. Now 77. The only thing which is working for me is purpose of life. And that purpose of life is taking care of my wife and son.
Okay.
That keeps me always moving.
So that is a hope you have. Having a hope, that always helps for the individual.
Yes.
Right, sir?
Thank you.
Thank you, sir.
Thank you.
Depression.
I have a question.
Yes, madam.
Nirmala Srinivasan here.
Yes, ma'am.
Yeah. Hello, doctor.
Yes, ma'am.
My question is, as a clinician,
yes, ma'am,
do you find any difference in the cardiovascular diseases as manifested in person with mental illness and without mental illness? Is there a difference?
No, ma'am. See, in terms of manifestation of
yes.
say cardiovascular event in persons with mental illness, without mental illness, there is no difference.
Okay.
They are same. So the clinical symptoms of, say cardiovascular disease will not change.
Okay.
Yeah. Yeah.
Clinical symptoms don't change, but the behavior patterns may be different.
Behavioral patterns, say for example, no, they may not report. Say for example, no, they have a minor cardiac event. No,
Yes.
for example, with a chest pain or no pain in the jaw or in the shoulder, they may not report it.
They means who?
Persons with mental illness, I'm saying. If
Okay,
they are
okay.
severely ill, no, they are not on treatment. No, they are currently highly symptomatic. They may not report.
Also, probably the person with mental illness tolerance, threshold of tolerance, pain tolerance is more than that of those others without mental illness, I think. Is that correct?
No, it is very difficult to say that. You know, whether
Uh-huh.
have a, very high tolerance for the pain. Very difficult.
Yes. Is it because of that they may not report?
No, say for example, what I'm trying to say is if somebody is having, hallucinations or delusions, they are involved in those, the
Yes,
thought
yes.
process. And
Uh-huh.
that thought process, they may not report that.
Yeah. Okay. Thank you, doctor. Thank you very much, doctor. I'll
Thank you,
raise.
ma'am. Thank you so much. Sir, depression can be treated by psychiatrist or counseling psychologist or clinical psychologist. Okay. Devi has this question. Okay. Devi, depression can be treated by all these people, but it also depends. For example, if I try to look at the guidelines, how depressions are treated, usually depression are graded into mild, moderate, and severe. No, depending on number of symptoms, how the depression has caused difficulty to that individual in terms of his occupational functioning, his biological functioning, his social functioning. If it has reached the severe, moderate to severe level, then the first line of treatment is medication. Okay, if it is a milder in the form, then usually it is treated by self-monitoring, which usually the counseling psychiatrist or a clinical psychologist, they usually advise, the methods, how you can monitor your own symptoms, how can you make changes in your behavior to improve upon. But when it reaches the degree of moderate to severe, that is the time when the so-called psychological intervention does not work. So we take the help of medications to bring it down, means to a normal state, and then we work on the aspect like if the depression is associated with certain IPR issues, psychosocial factors, or any other factors which can be dealt by clinical psychologist or counseling psychologist. Hope Devi, it answers your question.
I think there are no more questions. Both yours and Dr. Narsimhan's talk has really stimulated a lot of questions on the virtual audience.
Ma'am, there is one, somebody has raised his hand.
Is it? Okay. I'm not able to see.
116704.
Can I ask a question, doctor?
Yes, please go ahead.
I want to ask for a depression person, if he is going to park and there is two alternatives because limited time is there. He should talk to his friend. One thing. Another alternative is he should do the yoga in park. Which is better out of these two for depressed person?
Okay. So let me reframe that. What a person should do, right? So whether he goes to park and talk to his friends or go to park and do the yoga. Is it that your question?
Yeah, correct. Alternative, because time is limited.
Okay. I think you should do both. You should talk to your friends and do yoga with your friend. That is my answer.
Now, both is better, but suppose if friends are not doing yoga, only talking at a different place, and yoga is at park. So the out of two, which is better if we want to do one, choose one.
Both are required, sir. Both are required. Talking to your friends is a stress buster. Doing yoga is also a stress buster. One day you can do one method, other day you can do another method, but both are important.
Yeah, one day one method, another day another method. Correct. Now I understand. Okay, very good. Thank you, sir.
Any other questions?
Someone named iPhone has requested if they can ask a question. Please feel free to ask the question. We don't know who this is. Someone has logged in with it's showing us iPhone. So
Yeah.
okay. All right. Any other questions? We have our nursing students.
Yeah. May I ask a question, ma'am?
Yes, ma'am. Please go ahead.
Yeah. So I am a mother of two adult children. Adult means they are 25 and 27.
Okay.
And they are doing otherwise like responded well on medications and all and doing reasonably good. My concern is like as you're pointing that the cardiac health. So like my son, A is he has some habits of like eating too much of junk and then smoke also. So a little. And despite he fully because he is having an issue which in which he's like uh, working wonderfully, he's doing his work and everything, and he understands everything. But how, as a parent, can I stop? I mean, it doesn't come in action that despite they knowing, we persisting them for everything, but they continue and they being fully aware. It's kind of an addiction, I should say, that food, whether it is your coffee, whether it is your smoke, and despite you understanding that, yes, what are the consequences, and every day deciding, you get back to it. How do we deal with such a thing as a parent? And also, how can we help him?
No, ma'am, I think it is a very good question. Okay, so not only as a parents, maybe many other parents might have felt the same question what you are asking.
Yeah.
Say for example, so see, what we call is an unhealthy diet,
Yeah.
right?
Hansraj,
So which is actually very
एक बार थारो phone दे लो कहीं.
which is actually very tasty. Okay, so that's where people tend to increase the amount of such unhealthy diet because it's a taste, right? So so say for example, no, say the one which is a samosa or bhaji, which is fried in a deep fried in a oil. Say somewhere down the line, so that is one of the reason why the World Health Organization, Ministry of Health and Family Welfare sometimes releases IEC materials on so which are all the healthy diets, which better to avoid things including smoking. Say for example, say the the government also has made every effort. Say you have, all of us know that on the cigarette box, the picture of a cancer, especially the mouth cancer the picture is there, and it is very clearly written that no smoking causes cancer. So, and every movie you go to the theater or watch in at home, so that the information comes that smoking smoking causes cancer. And there is also an helpline in terms of say the government provides for tobacco cessation toll-free helpline. Yeah, the only thing is that individual has to make an effort to say quit the smoking or any other behavior. Somewhere down the line, as a parents, you kind of put pressure on them, but somewhere down the line, it is the responsibility of the individual to come out of that. Say you may ask him, do you need any help? Say, for example, even Nimhans has tobacco cessation clinic. Now every every hospital has, the NMC has mandated that every hospital should have the tobacco cessation clinic. And and
Yeah, but like the thing is, they decide in the evening, okay, Mama, we'll stop from tomorrow. And I really, yes, I know it's not good for me. And then in the next day, so they do say, okay, yeah, I need help, I think. Yes, I need help to stop it. 4 days down the line, there's in the same pattern, or a week down the line, or 2 weeks down the line. And then if you ask them, do you need help? No, I'll see, because, that kind of failure also sets in them too. That I've tried so many times, I get back to it. And so now, I mean, the total cessation thing, I think even in a lot of factors, we have started considering that even if how to lessen the harm, if not total cessation, can they make it? Okay, they start with 80%, then doing it. Because it's not happening, and they have tried, and every time when you put in a lot of your effort and you fail, it puts you in another loop of, yes, you have been unable to really do it. You also, I mean, you means the person who does for himself or herself also gets into this loop.
No, what you are saying, right? It's technically, it's called stages of motivation. Okay.
Okay.
So what say when they leave for 1 week and then again the relapse happens. Okay.
Yeah.
We undergo what we call as a stages of motivation, pre-contemplation, contemplation, the action, then they come to relapse. This is a cycle, individual go through, especially those who are addicted to substances. So it's a well-known fact. It's a well-known fact. But
yeah,
the clinician, our job is to helping them to move to the action phase, and being in the phase of say called in the phase of relapse, sorry, in the phase of action. Okay.
Yeah.
That is usually a clinician job. Usually, as a clinicians also, we teach our trainees that people go through these stages, and there are relapse and lapse and relapse cycle happens. So say this, either the scolding or will not work here. Rather,
yeah,
be with them to move on to the next stage. Okay. Till
okay.
the action phase.
Next stage means
Action. Say sometime they go back to the relapse frequently.
yeah.
So we need to take them from, say, when the relapse happens, they go into the pre-contemplation phase. Our job is to bring them to contemplation,
Okay.
then action, where they completely leave the substance.
Okay. So we as parents also don't have to give up at any point of time, even howsoever tired or exhausted we feel. We might take a break
Yes.
and we all get back.
That's what, no, that's exactly what I'm trying to tell you.
Yeah, got it. Thank you. Thank you so much.
Doctor, may I ask a question?
Yes, sir.
Sir, you are told about smoking, and it is good, is leaving smoking. But what about alcohol? Somebody take 2, 3 peg, 4 peg as alcohol. Then what is about it?
Sir, quitting alcohol also reduces the risk.
So even 1 peg should not be taken of alcohol.
So if you have a risk factor, then better you quit alcohol also.
Thank you, sir. So alcohol should not be taken even 1 peg. It is better, even if risk factor is not there in his family.
Sir, alcohol is known to increase the risk for cardiovascular diseases.
Yeah.
Yeah.
Thank you, doctor. Thank you very much.
Okay, sir, is there any routine cardiac screening test before starting any antipsychotics? Satya, usually if the person is if he's above the age of 40 years, we routinely get one ECG done, before starting them on medication. If it is say first time onset, we also sometimes, if there are any history of say chest pain, frequent, then also we get say ECG done in these individuals. So as I told, all person above the age of 40 years, whether whether you have mental illness, you are a caregiver, all individuals should undergo routine test, which includes ECG also after the age of 40 years. Sorry, I did not mention that earlier. Thank you, Satya.
Yeah, I think we are reaching the end. A lot of questions, and the talk was very interesting. And we are really very fortunate to have Dr. Sundarnag to address all the questions, because they were all very specifically directed towards people with mental illness and cardiac risk factors. I think the take home message is that, very aptly put by Dr. Narsimhan, your heart works for you, work for your heart. So I think that's a very good message, and that's for all of us.
Yes,
Whatever diseases we have or we don't have, whatever medications we are on or we are not on. So it's for all of us. And I think Dr. Milan can just conclude very briefly, and then we will end this session. Thank you very much.
Thank you, ma'am.
Dr. Milan, would you like to just tell a few words and conclude?
I think most of the parts have been covered during Narsimhan sir's presentation, as well as Sundar sir has been taking up a lot of questions from the audience. We have had a very variety of audience here with a very vast variety of questions also here. So from yoga to medication, even in investigation, screening, when to do, what to do, all those things, we have had a very it's a very comprehensive topic, the cardiac illness and mental illness, the bidirectionality, how one can affect the other. But likewise, ma'am, and Narsimhan sir's presentation, we have seen the take-home message of you work for the heart as the heart is working for you. I would say it's not a it's the small steps that we take that matters more than major steps. So let's all strive to kind of start including this in the area of wherever we are working. We have students here, we have social workers here, clinical psychologists here, as well as we have psychiatry trainers here. So anytime when we get into any kind of interaction with any patients, having asking small questions like what they are doing outside their routine for the improvement of their lifestyle, or the how they are taking care of their general physical and cardiac well-being. One simple question would not take much of time from our clinical during our clinical practices. So this is one suggestion, and one small thing if I can share here for all of us joined here. Thank you once again for to everybody who has joined here. Yeah, have a great day.